We're faced with a growing burden of chronic disease in society, chronic pain from musculo-skeletal disease and other causes, diabetes, respiratory disease. And with new developments and the growing burden of disease, there will be growth in prescribing. Unless we really seek to tackle that in a different way to the way we've done historically. We've developed a culture where we tend to follow guidelines quite rigidly, and guidelines are very good in that they provide a standardised care, but they also encourage quite a culture of mechanistic care where we might do things a little unthinkingly or without involving our patients in that decision making. And I think we need to move away from just blindly adhering to guidance and really using the guidelines as advice for things to consider when we're in a given situation with our patients and sharing goal setting with our patients. We need to get much better at assessing the value of our prescribing. And that's really what prudent prescribing is all about. It's not about rationing the drugs that we need to prescribe for our patients. And in order to assess the value of our medicines, we need to get much better at assessing the outcomes that those medicines give us. And that means reassessing, having prescribed a medicine to a patient, what that has done for the patient. Has it achieved the goals that we have set together? And if it hasn't, or if it's causing harm, then we need to stop those medicines, and we need to be much more proactive about doing that. We also need to get much better at defining the outcomes that we want from our medicines and other interventions and measure the things that are important rather than the things that are easy to measure.